Good morning. Absolute pleasure to be here and to see so many wonderful people from so many different places, from so many different organizations, but all committed to doing something very important, which is to deal with one of the most significant issues facing not only healthcare, but facing society in general. And that's obviously the issue of population aging. That has enormous implications everywhere, impacting almost every part of society, with, of course, a major impact on healthcare. But on healthcare defined very broadly. Not just what goes on in hospitals and health systems, but what goes on outside in the community as well. So I'm very privileged to be here. I'm Mike Dowling. I'm being very fortunate to be the president and the CEO of Northwell Health. For those of you that don't know, we are the largest healthcare provider in New York State and the largest private employer in New York State, with right at the moment over 90,000 employees, which will grow in the spring to well over 105,000 employees because of other expansions that we're currently doing. So just imagine for a second, with all of the talent in this room, what we can actually do when we work together. When we begin to fully understand what each of us do each and every day on this issue relating to aging, and what we can do if we come together more and more. And some of this is already happening, which I'm well aware, but what we can do if we expand that integration effort among the various groups here and others, and we have over 1,000 people actually watching online right now. Imagine what we can achieve. Because we all know the numbers, you know the issues. You know the 11,000 people every day that turn age 65. The fact that we've got 46 million Americans right now over the age of 65, and that number is going to grow to 73 million roughly by the year 2030. The number of people over 100 will quadruple in the next 20 years. Now this is, in many ways, you can sit back and think of this. This is an extraordinary success. Because of advances in science and public health and the overall quality of life in general, we're all living longer. 30 years we've added to life in the last 100 years. Success. But as we all know, with success comes lots and lots of issues that need to be addressed. I, for example, up to this point, I have lived 15 years longer than my father lived. When I grew up in Ireland, when somebody got to the age 55 or 60, you knew there wasn't much time left. Amazing progress, which, by the way, as we discuss all of these things over the course of today and beyond, it's important to recognize the foundation that has actually been built and the success that has been achieved. But also, as everybody here realizes, the understanding of the issues that all of this success brings that we now have to address. And there are many questions. I won't go into all of them, but there are a few questions that are important to ask ourselves and to think about as we go through the day and we think about the discussions that are going to be occurring subsequent to getting off the stage here. And the discussions that will occur, because what we hope to be able to do is to bring more and more people together more often in more of a coalition format to begin to work on specific aspects of things that are going to be discussed today. A couple of issues, a couple of questions, and there are many, how to enhance health, wellness, and independence as more and more people experience the benefit of time, longer time, extended time, a desire all of us wish to have. And the second question to think about, because it is more than just the provision of medical care, is how can we all benefit from the experience of elderly people, that accumulated wisdom that they all have, that history that they all have, that information that they can distribute and teach, the impact they can have on kids. And as I mentioned last night at another discussion we had, the desire that we all should have to get kids to understand the issue of aging more. And how we begin planning for a long life with kids. Because what we do at a young age, what we do during adolescence, what we do during middle age, provides the foundation to continue to provide an extended, healthy, independent life. Then again, and many of these will be discussed today, how do we think differently about care delivery? About what is meant by home care in the future? Or what we do with the issue of caregiving, the role of support systems and family. And of course, what we should be doing more and more with the issue of public policy. What public policy should we be pursuing in the future, given the reality, by the way, and a reality of aging that not only affects this country, but as you all know, affects every country in the world. Every country is dealing with some of the same issues. What can we learn from those other countries that are currently dealing with the same things? And then the question of what is it we mean, what do we mean by age-friendly? That phrase is going to be used today a lot. And that whole concept was initiated way back by IHI and Terry Fulner from the Hofstra Foundation. Age-friendly. We talk about it. It's a major priority at Northwell. What do we really mean by it, though? How do we know we have it when we have it? What are the criteria we use to determine that we're successful or not? It has to be more than rhetoric. It has to be real. And large health systems like Northwell, we have a responsibility not only to work inside our organizations, but to impact and influence that which happens outside. Because quite frankly, what happens outside is just, if not more important, than what happens inside. Now, we all know that we've made lots of progress over the years. We're not in a similar situation today, similar than we were back in the 1970s. Good things have occurred. And in the book that we wrote, which you will get copies of when you leave, we outlined a lot of the things that have progressed over the last 30, 40, 50 years. So we've made headway, but we have a long ways to go. And all of you in this room that are focused on this issue remember it's 50 years ago now that Robert Butler, whom I've had the distinct advantage of meeting a couple of times when he wrote that famous book, Why Survive? Imagine if we were to write a new book. What would the title of a new book be now, or 10 years from now? What would an aspirational title be? Now, his book was Why Survive Aging in America. An aspirational title, I don't know, Living Long in America, Enjoy Health and Independence. That should be the goal. We all aspire to it as individuals. That's what we all wish as individuals. How do we use our influence and our positions to make it a reality for everybody? How do we make the United States distinctive, positively distinctive, by how we treat those who have the advantage of living a long time? That's the challenge. That's the opportunity. That's what inspires all of us. That's what motivates us. That's why you're here. So, again, welcome. Thanks for being here. Imagine what we can do together. Thank you so much.